tell my audience the kind of neuro diseases that are everywhere, okay? Because there are so many different neuro problems that people can have. So tell us what kind of problems do you have?
Yeah, we have a lot of disease in I will take just my field about neurosurgery, and maybe I will talk a little bit about neurology, But in my field, we have neurotraumatic disease, neurotraumatic problem, TBI, trauma brain injury.
Yeah.
Benign, moderate, and severe. We have this disease that is very one of the first public health problem in Africa. We have that, and except a neurotrauma, TBI, spinal cord injury also due to traumatism, due to the trauma also, the etiology is multiple. You can see fraud, assault, or road traffic accident, all those things. I will not come in these details. That's the neurotrauma. It can happen in adults as well also, and the infant and the children, And we have also the problem of the neuro-oncologic disease also. Many people have the tumor on their brain that they do not know, especially in the children. We can see children who is just doing a vomit, headache, he become apathic. They will bring the children to the doctor. He will give him a drug because he eats something not good.
Yeah.
And at the terms, it's just because he have a tumor in
the brain.
In the brain. So
wow.
Don't hesitate when you have sometimes a recurrence of vomit, headache on the children. Please be aware. Try to see a neurosurgeon, on neuropediatric. Try to do on brain imagery, CT scan or MRI. Try to do it. That is about the neuro, and also as well in adult, when you have headache, always headache, you take painkillers, is not going on. Please don't neglect that. Go to see a neurologist or neurosurgeon. Go to see to check well if it's not on signs of intracranial hypertension due to some new formation in your brain. In the brain. And as well, in Africa, we can have also tuberculoma. We have also this in endemic. We are endemic zone in Africa. We can have as well also infectious pathology that can infect also the brain and the spine, and the spinal cord also. So you have to be aware about that also, and every time that someone have a wound after trauma brain injury on the head, we should also try to think about the infectious, like a suppuration, a collected suppuration on inside the brain. So you have to be attention about those, because that need sometimes emergency to be treated, to be diagnosed, and to be treated. The most important thing that I will talk to you, because I cannot go all in the details about the neurology, the disease that we encounter in our field. It is also to be aware about the stroke, because nowadays we have a stroke, we have ischemic stroke, we have also hemorrhagic stroke, and we have most important things. It's also the subarachnoid hemorrhage that many people treat just like a simple headache, but it's not a simple headache. Subarachnoid hemorrhage is devastating, because if it is due of the rupture of the intracranial aneurysm, it is a big problem, because that's correlated with a high rate mortality if nothing's done.
Yeah.
Normally, when you have subarachnoid hemorrhage due to the rupture of aneurysm, you should be treated within the first 48 hours. At least 72 hours, you should be treated to secure this aneurysm who is ruptured and give you an subarachnoid hemorrhage, because the risk of rupture, the recurrence of rupture, is correlated with more than 90% of death. You know.
Yeah.
So we should. That is the important thing that you should know when you have some some ictal headache. Suddenly a headache that you never feel before.
Yeah.
Please be careful.
Rush to
Don't
the
hesitate
hospital.
to go
Yeah.
hospital to try to do a CT scan.
Yeah.
And as well, we have some malformation also on the children, like spina bifida. We have malformation of cervical, occipital cervical, how can I call that, the Chiari malformation. We have this malformation as well in children, but the most of them is on children for the spina bifida, due to sometimes we correlate that with the deficit on the folate in the mom who have birth. So nowadays the policy should very be aware about that and systematically give folate to all young women who should give a birth on the first trimester and second trimester.
Yeah.
So and we have a lot of type of pathology. I don't know how can I say all of that, but tumor, infectious, vascular disease, and also sometimes we can have also degenerative disease like a Parkinson.
Yeah.
Like and sometimes a dyskinesia. Nowadays, a treatment exists for that, and so we can have also a metastasis in the brain, also in the spine. So all these things nowadays it's possible, to treat them. And what is very important, what is the news is nowadays it is possible also to treat people, to operate people, in the awake. That was my dissertation to become neurosurgeon. It is awake craniotomy. It is possible to make people awake, to do the brain mapping, to preserve his cognitive function, everything, and to remove safely tumors.
That's great. That's great. So you can be doing doing surgery, and you be asking your patient if he feels something, if he can move.
Exactly, to do some tests,
to make sure it's working. So that you don't take away. Yeah, very, very good. Very good.
Not just a problem of elder, of old adults. Also, the young adults also we are exposed about the stroke. I think we talk about that in the short moment.
Yeah.
But we should take care about the stroke, whether ischemic or hemorrhage.
Yeah.